Good morning, everyone. Thank you for being here this morning. My name is Jennifer Stefano. I'm the State Director of Americans for Prosperity here in Pennsylvania. And we're going to talk today about the governor's plan for expanding Obamacare into the state of Pennsylvania by taking new Medicaid dollars. And one of the things we did, as you know, is that we asked two of our friends in Arkansas, a state senator and a state legislator, to fly in. And one of the reasons we did was because for those of us in Pennsylvania, we have been warning and talking about the problems that will be faced by working families and those put on to the new Medicaid dollars. We've talked about the dangers and the problems with that. But of course, as a mother, I know that sometimes, no matter how much you say something, when it comes out of your mouth, nobody wants to hear it. But unfortunately, Arkansas did what Pennsylvania is about to do. And while the intentions were good, the results were not. And so that is why, and it's Americans for Prosperity, we do oppose the governor's plan to take the Medicaid dollars coming through Obamacare and expanding it into our state. We understand the governor had good intentions in doing this, and we appreciate that he invited us in on Friday afternoon to give us detail on what we have been reading in the press. But at Americans for Prosperity, we're focused on the results because there are working families like my own, like yours, like so many across the states, whose very future relies on this. So of course, I think the best people to explain why the Arkansas model, which Governor Corbett said he adopted and used, is not going to work, not in Arkansas, not in Pennsylvania, not in any state, and how it negatively impacts our working families. I'm going to bring up our two legislators. The first one is Representative Jim Dotson. He's a representative from Arkansas, and he has been part of the healthcare battles going on in the state. First, thank you so much for flying in and taking the time. Thanks for being here.
Thank you. My name is Jim Dotson, and I think to really get a grasp on what's going on, you got to have a little bit of the history in Arkansas. In January, we entered the session after the Republicans took over the House majority, saying that they would fight against Obamacare for the first time in 138 years. And so we entered the session with the option of whether to expand Medicaid for the state or not. Throughout the course of that session, January, February, March, into April, the discussions came around to this private option plan. So there was a third option. This private option plan, it's health insurance that's paid for by Obamacare, Medicaid by another name, Medicaid expansion by another name. So it is accepting those federal Obama dollars for expanding and paying for health insurance in the state. Two things to keep in mind on what it is. This is really the two things that it does. One is it increases government spending. And two, it adds a lot of people to an entitlement that they're not currently on. In Arkansas, it's estimated there'll be 1 in 3 in the state that will now have Medicaid subsidies. Estimated total cost in government spending over the next 10 years is roughly 10 times what it would have been if the private option was not implemented. 5 months later, fast forward to today, and 2 weeks before open enrollment starts now on October 1st, we still don't have the waiver approved through Health and Human Services. And we still don't know what the plans will cost. The plans are still out there. Insurers have bid on this, but we don't know what the cost of that will be to individuals or to the state. Basically, we passed the biggest expansion in state government history. This was not a limited government plan. Every single Democrat in the House and Senate voted for this, along with several Republicans. After it was passed, the Democrats loved saying that they got Obamacare. They boasted about it. They said they had to dress it up with a trunk and elephant ears but they won. Republicans who support it are still trying to appease their base and sell them on the idea. It has proven extremely difficult to implement any type of the promised reforms that were sold. In fact, be careful of the details of the plan because it sounds very similar to what was promised, but what was actually passed in law, the details were not quite the same. Even community health clinics who lobbied heavily for this plan have cried for changes to the private option because they will be losing money with private insurance. They won't be making as much, and they're concerned they'll go out of business with this. And they still want more money. So all in all, this is simply Medicaid expansion or Obamacare by a different name, but it is still paying for increased people on entitlements and increased government spending. Thank you.
So to clarify, at Americans for Prosperity, we consider our job to represent the taxpayers and the working families of the state. So to be clear, I know Governor Corbett and his staff has said that this isn't expanding Medicaid. They actually noted that Medicaid is going to be less. There are going to be less people on Medicaid under the governor's plan. And just so you're aware, there are two fundamental questions that have to be asked. Is number one, is Governor Corbett going to take the money from the federal government, new Medicaid dollars under Obamacare? The answer is yes. The second question is he going to use that money, whether on Medicaid or the private exchange, to add anywhere from 500,000 to 1 million new people onto public assistance for health care? The answer to that is yes. And then to ask what happens when that money over the next decade declines. And we're left, ostensibly right now, Congress has authorized that in 10 years, they'll pay 90% of it, if Congress keeps its promise. And I will leave room for hearty, cynical laughter. The concern is that states will be on the hook, not just for the 10%, but much more. And that in 10 years or sooner, there will be close to 1 million people who do not have federal dollars flowing into the state. It is simply not sustainable for Obamacare to feed 50 states this kind of money and have it run for the long term. It is not economically feasible. So we know that Pennsylvania is once again going to be in jeopardy. Any way you slice it, any way you call it, this is a massive expansion of Obamacare into the state of Pennsylvania. What we're asking for from the governor is what I think all Americans are asking for from their elected officials. In fact, we're asking for the same thing the heads of the unions asked of President Obama when they went in the other week to have a face-to-face meeting with the president. The heads of the unions in America asked that the unions and their workers be exempt from the law that just a year or two earlier they were advocating for, asked the president to exempt them. The president said no. We ask nothing more of Governor Corbett. Please protect us from this law in every way you can. The states don't have a lot of options, but we do have some. And one of the options is to not take this money from the federal government and put the Commonwealth of Pennsylvania on bended knee to nameless, faceless bureaucrats in the Department of Health and Human Services that are unable to even give the most basic answers to how this will work. I don't think, on behalf of the taxpayers, this is an unreasonable request. As a working mother who tries day in and day out, like every mother and father and person across the state, to take care of their family, this is going to, in the end, be a detriment to us. The governor already did the right thing by not setting up a state exchange and leaving it to the federal government. We ask Governor Corbett to do the same with this. If President Obama and those that voted for the law feel that 1 million more people in Pennsylvania need to be covered, then they can come in and find the way to do it. It should not fall to the working families and taxpayers of the state. You can call it whatever name you want. You can say it's not expansion. You can say it's not Medicaid. But if those three fundamental questions I asked in the beginning are answered in the affirmative, then it is one of the largest government expansion programs in our state, and it is an absolute entry for Obamacare to come in. So up next, I asked Senator Jim Hendren from Arkansas to come and talk about what this state, what this expansion and this model, which Governor Corbett has set up with private insurance, so public dollars paying for private insurance, what that is going to mean to the people of Arkansas and what it will then mean to us.
Thank you, Jen. It's good to be in Pennsylvania, and it is really amazing to come, and it's like we have stepped back in time 8 or 9 months in history, because this is exactly the same conversation that we had in Arkansas. And I just want to make a couple points for the folks of Pennsylvania based on what we have learned the last 8 or 9 months in Arkansas. And the first one I want to make is, you will hear a lot of discussion in the upcoming weeks and months from those who will advocate a private option type of plan, that this is not Obamacare, that this is not Medicaid expansion. And let me just tell you, in Arkansas, we had that exact same discussion and continue to have it. And what I want to be very clear about is it did not sell to the people in Arkansas. The voters in Arkansas see this for exactly what it is. It is Medicaid expansion. It is Obamacare. Calling it a private option, calling it a reduction in Medicaid rolls because we're taking them off of Medicaid and purchasing them a private insurance policy with tax dollars, and saying that is somehow different, is a very thinly veiled smoke and mirrors trick that the voters of Arkansas are not accepting. There will be some legislators not return because the voters of Arkansas are frustrated that this kind of shenanigan was pulled on them. And I expect the same reaction from the voters of Pennsylvania. It is not hard to realize, as has already been mentioned, when you take, and I guess one of the things I want to make that we had a lot of discussion about in Arkansas, this idea that federal dollars are free, that federal dollars are not, that they are coming from President Obama and Obamacare like there's some magic goose in Washington that prints federal dollars. We all know better, and the voters in Arkansas know better. It comes from the taxpayers of Pennsylvania. It comes from the taxpayers of Arkansas. And they are the ones who are going to be paying for this expansion. And be very clear, it is an expansion. The other thing I want to talk about briefly is what's happened since we did this. Because again, if I come back 8 months from now, I expect to see a very similar path for Pennsylvania, because you've sought out on the same path that we have. Here's what we've seen so far, as Representative Dotson has already explained. We are 2 weeks away from open enrollment supposedly beginning on our online exchanges. And we still haven't gotten word from Washington if our waiver is approved. We have spent millions of taxpayer dollars. Now they'll say they're federal dollars, but again, where did they come from? We have spent millions in Arkansas advertising a program that we don't even know is going to be approved yet. We have hired hundreds of new employees, state employees, that we know will only be on the rolls for 2 years to help implement Obamacare, navigators they're called. Navigators that are established by the ACA. We've already hired these people. They're going to be on the state rolls to go out and help people enroll in this program that we don't even have approval yet. And because we don't have approval, the insurance companies will not give us the rates. We don't even know how much these private policies are going to cost in Arkansas, and we're supposed to have people enrolling in 2 weeks. And we're supposed to have people covered by January the 1st. I have had members of the administration already come to me and say, don't hold us accountable. We're going to have a lot of problems with this. And everybody wants to blame Washington or blame this or blame that. But the fact is, it's not going to go well, and we all know that. Let me talk about one other thing, is because I hear this exact same discussion in Pennsylvania, this idea that the reason that we're doing this with some conservative people involved in this, and believe me, in Arkansas, some of the most conservative legislators were right in the middle of this. But the reason that we're doing this is the only way that we can get the needed reforms to the current Medicaid system. In other words, we are allowing ourselves to be extorted by the federal government, saying, if you want to reform the system, to eliminate fraud, to make it more efficient, you have to take this expansion. I don't accept that that is a fair way to deal with the taxpayers, to say we will not help you root out fraud unless you do what we say. That kind of strong-handed tactic from Washington was successful in Arkansas, and I hope that you all will stand strong here in Pennsylvania. And let me just finish with this, because this is, again, one of the biggest reasons that those of us who oppose this and continue to oppose this have such strong reservations about it. The first one is, as already been mentioned, this has been sold to the people of Arkansas and to the governor of Arkansas and to many of our legislative leaders as this is a way to solve some of your budget problems. All this money from Washington is going to help you fill some of the gaps that you have in your current DHS programs. And the reason is because Washington's going to fund it 100%. And the argument has been told to us, and I'm sure it will be told to you, if we don't take this money, it's going to go, your tax dollars are going to go to other states who do. And I struggle with that because, as I said, I think it really misses the whole point. Number one is this idea that your dollars are going to go to somewhere else is completely false. There's not going to be $1 of Pennsylvania go to any other state whether you accept or reject this Medicaid expansion. You'll be told that, but I'm telling you, that's not how it works. The second thing about this is this idea that we can depend on the federal government to fulfill its obligations in every commitment that they've made to the state is not historically accurate. They haven't for Arkansas, and I would be shocked if they have for Pennsylvania. Look at the challenges facing the federal government with sequestration, with debt limit discussions going on. Do we really think that we can count on them to pay 100% of this bill for 10 years? And even if they do keep their obligations, at least in Arkansas, that means in 10 years, we've got to find another $200 million out of our state budget to fund our portion of it, which at any time they can change that portion by simple legislative change. And the final point I'll leave you with, again, is my biggest problem with this, having become a grandparent recently in the last couple years, is this idea that we are continuing to borrow money from our grandkids' generation to pay for entitlements for our current generation. You know, many of us got elected opposing continued deficits and irresponsible budgets. Well, when we partake of this program, a program of this magnitude, we have no longer any position where we can stand and say we're opposed to that kind of stuff. We are now part of the problem instead of trying to fix the problem. And that's been the challenge in Arkansas, and I hope it is a challenge that you overcome here in Pennsylvania. Because the fact is, as we all know, the time is rapidly approaching when the federal government's going to have to make some hard decisions. This is not the time to be depending your future of health care for the people of Pennsylvania on a federal government that is completely broke. Again, I appreciate y'all having me up here. I wish you the absolute best in this endeavor, and I certainly hope that Pennsylvania will do what's best for the people of the state, which we believe is not following the Arkansas model in an implementation of expansion of Medicaid or Obamacare. Thank you.
And the legislators will take questions right after this. And as you notice, there aren't a lot of Pennsylvania legislators here because we wanted to make sure that the Arkansas legislators had the full attention of everyone. But however, we did ask one representative to come and join us today, and that's Representative Metcalfe. I think he's a stalwart champion of working families across the state, and I think he is excellent at articulating how this is really going to impact us in Pennsylvania and why he was one of the leaders in a massive press conference back in the spring in opposing Medicaid expansion. He stood with 70 other Pennsylvania legislators, and of course, there were 33 brave legislators who put a letter out to the governor and their leadership that if Medicaid expansion was included in the budget, that they would not vote for the budget. They withheld their vote, and that's a very brave decision. It could have political ramifications for a long time. So we appreciate that on behalf of the working families of the state. So please now, let's write up Representative Metcalfe.
Thanks, Jennifer. Thank you, Jennifer. I'd like to thank the senator and representative from Arkansas for making the long trip here. I got up around 5:30 this morning and drove from western Pennsylvania to make it over here in time for the press conference
this morning, but they had to catch a plane yesterday to come all the way up north. So we really appreciate them taking time out of their schedules. And of course, the sacrifice for them was to get here yesterday, be here today, and then finally get plugged back in, hopefully, into their own schedules tomorrow. So thank you guys for making the trip here to Pennsylvania to share with us the mistake that was made in Arkansas and the path that the governor seems to want to put us on to make an even bigger mistake here in Pennsylvania. And years ago, I had written one of my monthly Metcalfe memos on some legislation that had moved about and legislation that does move through the Capitol, and how at times politicians try and rename pieces of legislation or rename taxes to give the voters some impression that they're getting something different than what was already proposed. And that's exactly what the governor and his team have done here yesterday, was to propose Medicaid expansion, propose a welfare state expansion, and try and sell it to the voters under a different name. But of course, it's not the governor that came up with that idea. It's being done in Arkansas and other states around the country. But the governor is playing a not-so-good shell game. I started watching some of his press conference a little bit last night before I had to hit the rack to be able to make it down here early this morning. And to be honest, I didn't make it through the whole press conference. It was painful. As he read his prepared remarks, he was painfully making his way through them, and he was not moving the shells fast enough to fool the voters. Because when you propose taking tax dollars from the federal government and spending that on adding people to the welfare rolls in Pennsylvania, whether it's insurance that's being provided by government or insurance that's being provided out of the private sector, it's still being paid for with tax dollars. Whether it's coming out of our federal tax pocket or our state tax pocket, it's still a burden on Pennsylvania's taxpayers. And that's what the governor is proposing. The governor was correct earlier this year when he had stated that with 1 in 6 Pennsylvanians on Medicaid, we cannot afford the current system, much less a new system to where we could see up to 1 in 4 Pennsylvanians being on welfare for their health care in Pennsylvania. So as the governor tries to move these shells in his shell game, and he's put a lot of dressing out there, as the gentleman from Arkansas were talking about some of the other reform measures that are being proposed. He's put some small carrots out there for conservatives across the state and for voters across the state to say, yeah, that makes sense, we should have that type of reform, or we should have that type of reform. But at the end of the day, the majority of what he is proposing in his health care plan that he announced yesterday is to put, as Jennifer had said, more than 500,000, possibly close to 1 million more people into government paid for health care, which is an expansion of the welfare state in Pennsylvania. And the last time I heard from voters, which was as recent as on Facebook about this morning and yesterday, the voters of Pennsylvania aren't buying any type of welfare expansion. The governor can call it whatever he likes. He can try and say it's not Medicaid expansion, but at the end of the day, everybody who's honest with themselves has to admit that this is expanding welfare in Pennsylvania. When you're going to use government tax dollars to buy insurance and force the taxpayers to pay for their neighbors' health care, that is welfare. We can't sustain the current system. We need reforms. But as the gentleman from Arkansas said, we can't have reforms at the end of an arm twisting that ends up getting us in deeper than we were before. The governor is proposing to add more people to welfare in Pennsylvania. I wish he'd be honest with the people of Pennsylvania and just say that. The governor is not going to get away with, at this point in his term, coming out and making this type of proposal and thinking that it's going to save him in next year's elections. The governor is not going to be able to sell this to the electorate. As was said from the gentleman from Arkansas, if this was to be passed in the state legislature, which the governor seems to think he doesn't have to come through the people's elected representatives to make this happen, although looking at his press release yesterday as I read through it this morning, certainly there's components of it that he has to get approval from the legislature. He must get approval on certain aspects of this plan that he announced yesterday from the legislature. So for him to think that he's going to bypass the people's elected representatives and that he's going to do that and fool them, he's mistaken, because the Democratic caucus, the Democrats in both the House and the Senate, if this were to pass, would, just as they did in Arkansas, claim victory for Obama and Obamacare implementation. Because what Corbett is going to do is help to facilitate the advancement of Obamacare in Pennsylvania. Recent polls show that the majority of Americans aren't buying Obamacare any longer. They understand that Obamacare is killing jobs. We're seeing one company after another lay people off or do away with positions or reduce hours based on having to implement Obamacare or the fear of having to implement Obamacare in the near future. So with people losing employment and healthcare costs rising, the people of America, the citizens of the United States of America, understand Obamacare is costing us, it's not helping us. And Tom Corbett must understand that embracing Obamacare in Pennsylvania through an expansion of the welfare state is not going to help Pennsylvania, it's going to hurt Pennsylvania taxpayers.
Very much appreciate it. Our friends from Arkansas and Representative Metcalfe, myself as well, are certainly open to any questions you may have.
Gentlemen, you had mentioned that the federal government is twisting the state's arm in implementing some of these reforms, but Pennsylvania has in the past implemented some of these reforms with not through Obamacare. They have reduced benefits through Medicaid. So if they've done it before in the past, why are you alleging that it's all tied together here, or is it just the governor has tied it together himself?
I see happening here the same thing that happened in Arkansas, and that is a tying of things together that many conservatives want and appeal to that base in order to try to get some of those who are on the fence to vote the way that's necessary. That's what happened in Arkansas. And you're right, many of these, and that's my point. There is no reason, we have passed reforms in Arkansas on many benefits, unemployment benefits, healthcare benefits, fraud abuse. We've passed those things in Arkansas in the past without tying it to any huge expansion. But for some reason, in Arkansas, it wasn't just reform that was tied to this expansion, it was tax cuts. Our governor basically said we could not afford any tax cuts in our state unless we passed this expansion, which to many of us who try to apply basic principles of mathematics, we don't understand how that works. If you increase spending, then you can afford tax cuts. But that's what we were told. So I'm not saying I agree that it's necessary. I'm saying that's the tactic that is being used here and was also used in Arkansas.
I think that you can do meaningful state reforms without asking the Fed. But there's a lot of quote-unquote free money, Obama bucks sitting out there that are very enticing. And so in order to capture that increased federal spending for the state, it was tied to the reforms. So could we have done reforms? Absolutely. Should we have? Absolutely. That's what we were elected to do. Did we get those done? Some of them got reformed. But we also captured a lot of increased federal spending and added a lot of people to an entitlement in the state of Arkansas.
And there are reforms that we've proposed for years on Medicaid and the welfare system in Pennsylvania, and some that were still proposed this session. Some reforms we're able to implement without having changes made at the federal level. Some were not. I know one of the changes that I keep getting asked about, I was just asked about it the other day. Actually, I was at an evening event, and a young lady asked me, well, what about welfare recipients that are not being drug tested? And Florida, I know, has been one of the states that's led the charge on that. And due to the way the federal law is written, the federal courts have ruled against states actually implementing that full blown out requirement to say if you're going to receive Medicaid or you're going to receive welfare, then you're going to be required to have a random drug test. Or you could be required to have a random drug test. So, I mean, we passed a limited version of that here in Pennsylvania, but it's not what ultimately many of us desire or the voters desire. So I think there are reforms that Corbett's trying to negotiate with the administration, with the federal administration, the Obama administration, that they would believe we wouldn't necessarily receive under just trying to advance it as a state.
Mr. Metcalfe, you had mentioned that there are elements of this that will need legislative approval. Can you be specific about those?
Like, I was just reading through briefly. I think the one that comes to mind is dealing with CHIP. I think the governor is, I believe I don't have his press release in front of me. I think one of the things that he proposed was having kids that didn't have a 6-month waiting period before they got on. I believe that would need legislative approval. I think the majority of it, I believe, would actually need legislative approval. I think the governor would be wise to try and get legislative approval. Whether or not he thinks the current statute allows him to do it or not, I think the governor would be very wise to actually bring it before the people's elected representatives and share this decision with the people's elected voice, because if he doesn't require legislative approval, we could certainly pass legislation that would require him to get legislative approval. Now, the chances of that actually moving through the Senate when they already passed an expansion of Medicaid are slim to none, but the legislature has the ability, with a governor who expresses some arrogance in avoiding the people's elected voice, that we have the ability to come back in and require the governor to get approval.
Is there anything Medicaid related that you think would have to, anything Medicaid related you read in his plan that you think would have to come through the legislature?
I don't have any examples. As I said, I had my staff talking with legal staff this morning, and they were pouring through some of the details. I mean, we've only had his announcement yesterday. I had a verbal briefing on some of it last week from the Secretary of Welfare, Bev Macarith, but I didn't have anything in writing until yesterday, and our legal staff, I know this morning, was looking at it for me, and we had between people come in mostly at 9 till 10 o'clock to get those, but I'll be continuing to look through it. But I think the governor has taken liberties with other situations since he's been governor. His administration has, and done things that would have needed legislative approval, and he's not done it previously, and I expect him to move forward now if he's able to get away with it.
But when you say that, I think the governor would be wise to get legislative approval, whether he thinks the current statute requires it or not. You're talking about the Medicaid elements.
I'm talking about everything he announced yesterday, and I think the very foundation of what he announced yesterday is the welfare expansion, is taking people from Medicaid to a new government subsidized health insurance plan and trying to call it something different than what it really is, which is just taxpayers paying for their neighbor's health care instead of 1 in 6 people, 1 in 4 people.
Do you think it would pass the House?
With him dressing it up like this, it wouldn't surprise me to see him gain some additional votes as they seem to in Arkansas, with what was done down there from some of the Republican legislators. But I don't necessarily believe that he'd have a majority, because I think the majority of our caucus has stood solidly against expanding the welfare state. Although we do have one leader that seems to be interested in expanding it.
We are vigorously, Americans for Prosperity, vigorously going to advocate that the governor sends it through the General Assembly in Arkansas.
I take the microphone.
Yeah. In Arkansas, it's a Democratic governor and a Republican-controlled General Assembly, and the governor still sent it to the General Assembly. So I think we need to see where all of our elected officials are. That is the voice of the people of the state, who are going to have to pay the bill when Governor Corbett's gone, right? 10 years from now, Governor Corbett's not here. I am, you are, all the working people of the state are still here, and we're gonna have to foot that bill. It is important the voice of the people is heard. The only way our voice is heard is you have to send that vote through the General Assembly. It has to be done.
Any other questions?
You had a question? No?
Yes, sir.
The Arkansas plan, along with the other private option plans, the Congressional Budget Office has said it's going to be more expensive than if you just put people into Medicaid. I know you said that you haven't gotten a cost yet for the policies, but do you have any inkling as to how much more it may cost?
About how much more, I can't say. I can say, let me just tell you, when this bill first emerged, in a Senate caucus, I asked some of the authors of this bill, 2 senators, I said, explain something to me. You're going to take these people, rather than putting them on traditional Medicaid, you're going to basically buy them a private insurance plan. Private insurance, we know, pays higher reimbursement rates than Medicaid does. That's why a lot of doctors and hospitals are getting out of the Medicaid business. How is it that we're going to put, and also now private insurance is in it to make a profit. Medicaid's not. I said, how are we going to give people a insurance program that has higher payouts, has a profit margin in there, and tell the taxpayers it's going to cost less. And the only answer I got was, well, we're going to do some reforms. I don't believe you're going to reform the cost that this is going to be to taxpayers. It is going to be more expensive than traditional Medicaid expansion. Now, I believe it's a better product. If I had my choice to be on private insurance or be on Medicaid, I'd rather be on private insurance, as most people probably would. At least I don't know about your situation, but in Arkansas. But the reason for that is because it's a better product, and better products cost more money. So I think that's part of the resistance to getting these cost estimates out there, is because there is going to be sticker shock. And I think that's one thing the people of Pennsylvania need to recognize. When you hear that this is a more affordable solution, it's not. You're putting a middleman between the patient and the payer, and that is the insurance company, who's going to take a profit slice out of that and is going to pay the providers higher. So how that's going to be less expensive, I do not understand. So to call it a conservative approach, it's going to be a bigger bill for the taxpayers.
And I think I saw it at least twice in the Corbett press release where they were relating back to some of the savings that they thought they would find in Medicaid, that they were going to reinvest those dollars in the new entitlement, in the new subsidy. So they're not talking about reducing costs in Medicaid and giving those back to the taxpayer, any dollar savings. They're talking about reinvesting it in new entitlements through the new insurance. So, I mean, you can safely say we're going to see the federal government pour billions of tax dollars into Pennsylvania as a result of this new expansion, billions of dollars. And those are coming from our federal tax pocket. There's no free money. Whether you're taking it out of my federal tax pocket or my state tax pocket, the hardworking men and women in my district, whether you're taking it out of their right pocket or left pocket, it matters nothing. It's taking more money from the taxpayer, and that's what this will do.
Can I just add one more thing to that, because I think it's important for particularly Representative Metcalfe and the folks here to understand. We went through this in Arkansas. I spent 6 years in the Arkansas House, and then now I'm over in the Senate. And there was some time in between. I've been involved in state government for a long time. And let me just say, I have never seen the kind of lobbying effort brought to bear on legislators as was brought to bear on this particular issue. And the reason is because you are talking about hundreds of millions, if not billions of dollars that somebody's going to get. Now, under a tradition, and I think you will find a higher lobbying effort brought to bear under a private option scenario than under a typical Medicaid expansion. And why is that? It's because there are literally millions of dollars to be made for insurance companies and hospitals and doctors under higher reimbursement rates. So don't be surprised when you see all the stops pulled as far as an effort made to pass this plan because of the amount of dollars that private companies and other interests have to gain from this. It is going to be massive.
Last thing, you said that you haven't heard yet about approval. Has the federal government given you a ballpark when they're going to get back to you?
You know, the federal government's not known for being timely and punctual, and you would think with the idea that they have implemented this October 1st enrollment deadline, they realize that in order for us to meet that deadline, that's why some of the folks in our insurance department are a little bit frazzled, because they've got 2 weeks to have this thing ready to roll out, and they don't even know what the federal government's going to say. Their hope is that they'll accept the waiver as submitted with no changes, but if they come back with 3 or 4 changes, the Arkansas law was written to the point that if they do not accept the waiver as is, it goes away. So it's really a high-stakes poker game, and who's going to blink on this deal. So there's talk, there's rumors going around that they've approved it. They just haven't, you know, the ink hadn't dried and they haven't sent it to us. Now, but again, as far as official approval of the state of Arkansas, as of when I left town, it has not been received, and it is, we cannot get rate quotes until that happens. So the question is whether or not there's going to be a delay, and whether it's just like we saw a delay on the implementation of the employer penalty. And let me just say one other thing. That was one of the things that was used to flip a bunch of Arkansas Republican legislators to vote for this. Was the idea was said, if you don't support this, all your employees that have more than 50 that don't provide a qualified plan are going to get hit with this employer penalty. And in Arkansas, it resulted to a $30 million, supposedly to some calculations, tax increase. So the idea was, if you don't vote for this expansion of government, you're voting for a tax increase because of this employee penalty. And as we all know, that employee penalty was delayed now another year. We may see similar things happen on this. And again, I think it's very prudent to not go wading into this until the water's settled a little bit.
How long have they been reviewing it?
Well, we adjourned in April. I think it took the state a couple months to draft the entire waiver, so they've had it a couple months now.
1st of August was
Yeah.
when they actually submitted it, somewhere right in there.
Can I ask, who's paying your travel expenses that you're hosting here? in
Americans
Harrisburg?
for Prosperity. You're welcome. Just one thing, just so you know, I mean, the federal government, and we've been working as part of a national policy working group, trying to get clarification from Health and Human Services, just on a policy front of where they're going to go with some of this. So, and just understand, whether or not the Arkansas plan is accepted by HHS, we still oppose it. And we have, and I'll get you the exact timeline, but I want to say 8 or 9 months ago, HHS just issued 350 new rules and regulations, for starting a state exchange. Every time you touch this, you get drug in more and more. Every time the states agree to handle an aspect of it, they get drug in more and more. There is a cost to this type of burdensome regulation. You need staff, you need people, companies need that. And I think obviously the headlines in all of the papers, whether from Philadelphia to Pittsburgh, have been about the effects on people. Whether employers are cutting it, UPS just dropped all the spouses on their health care plan and otherwise. But what's even more burdensome is for these legislatures is to say yes to something today and find tomorrow or in a year or when the people who said yes to this today, like Governor Corbett, are gone, we are still dealing with the painful ramifications. And we've even asked the IRS to please give us, the IRS, you will be required in January 2014, all of us are required to tell the IRS and turn over some medical information to prove we have insurance. So we've petitioned the IRS to ask, what? What do we have to turn over to you? Let's see the form. The IRS doesn't have it. They don't have it. There is nothing ready for this. Any governor that can protect his or her people from Obamacare has an obligation to do so. They should never do what Governor Corbett and what Arkansas have done and take the money.
Chairman, you said that you think this wouldn't help the governor for next election, or you called it a shell game. Are you accusing the governor of doing this just for political points?
Well, I think the motivation's political. I think the Senate passed this in a supermajority fashion. I think the governor's trying to appease the state Senate by moving in their direction on this and giving us the window dressing to have hopes that he'll buy enough support in the House to find overall support in the legislature, whether or not he asks for it or not. So, I think it's. I don't think there's any other reason for him to do it. Why in the world would a Republican governor move us in the direction of having 1 in 4 people on government paid for health insurance? To expand the welfare state to that extreme, to expand the welfare state, why would the governor do it unless he saw a benefit in it for himself in the future? I think yesterday the doctor that introduced the governor was given quite a list of things to say about the governor. I think it sounded like a campaign speech introduction more than it did a gubernatorial policy briefing. I mean, I would have been embarrassed if they would have read the same things about me during a time when I was supposed to be addressing state business. It was, I think it was fully an inappropriate use of that time to talk about policy when they're trying to promote the governor as they were prior to his statements yesterday. I certainly wouldn't do it working as a legislator, but no, my stand here today is is purely to stand up for Pennsylvania taxpayers and to try and stop this continued welfare state expansion that the governor seems now bent on promoting. Any additional questions? Everyone have a great day. Thank you.